And we are back with our pre-ownership underwater segment. Working title there. I'm not totally comfortable with it, but
It's
it's
pre-owner underwater.
Pre-owner underwater. I guess that's
Pre-owner
not
underwater.
bad.
Yes.
POU.
Yeah, that's a great title.
POW. I don't know.
POW.
Yeah, we'll be using a lot of onomatopoeia here. But anyway, so what we have here today is a listener that emailed into the show. He's going to get into the details with you guys, but I really like this sort of situation because he's done a lot of groundwork. He knows who he is. He knows what he's looking for, and he's got two really nice options ready for us that we're going to kind of, pick apart to pieces. And I'm going to go ahead and let him introduce himself with his fake identity, which I hope he's chosen a fun one.
All right. My identity is Patrick.
Patrick. Last time we had Batman, so I appreciate Patrick. Something a little bit more serious.
Kind of. The background behind it is so my brother, we called him SpongeBob growing up.
Oh, okay.
It's a little less serious.
All right.
And so I was like, well, I'm a friend of SpongeBob, so we'll go with Patrick.
Yeah, okay. Pinhead Larry.
Brother from another mother. All right.
Oh, that's fantastic, Patrick. So tell us a little bit about who you are and where you're coming from. Have the audience get to know you a little bit.
All right. So I am active duty military. I've done a 2-year residency that I completed, the comprehensive dentist program. I like to extract a lot of teeth. I like doing pros, mostly a lot of CAD CAM.
Oh wow!
Not generally like full mouth stuff, but just kind of somewhere in the middle. So, but contract's coming up to an end here this summer. My wife is a dentist. So we met in dental school. Military's been really good to us. We've really liked it a lot. But our goal is to set up practice together, to work together, take turns watching the kids, and be something that we can both grow our careers together.
Okay, yeah, that's fantastic. So, what brings you guys to the conclusion that ownership is something that's going to work for you too?
My wife grew up around dentistry, and then my brother is a dentist, and so it's just kind of something that we want to have the control over what we're doing, and trying to make it work together. We'll just want to have that control and being able to run things how we want.
Okay, that's excellent. And so what's your wife been up to? What's her dental career been like? Is she in the military as well?
She's not. So she's been able to find a job wherever we've gone other than here, where just with the state licensure and stuff, she wasn't able to do that without taking the rep. So she stayed at home, which has worked out. We've got 3 small kids, so it's worked out fine here, but she's ready to get back in it.
Okay.
So are you guys looking for a practice in the similar part of the country where you're currently living with the military, or are you guys looking somewhere else?
We're looking somewhere else.
Talk a little bit about, have you guys like defined a vision for your practice, in terms of how you two see yourselves? I know you said like alternating days, but anything more specific on where you guys see yourselves working together or how?
Right.
So my wife is more bread and butter dentistry, and then I like a variety of things. So I have been working private practice up here where I'm at, and I've come to like pedo a fair amount. So if I'm doing some pedo along with some pros and some oral surgery, along with some bread and butter stuff, I think I'll be pretty happy. And then my wife's happy doing bread and butter dentistry, and starting there and then just kind of seeing where it takes her from there.
Right. So I think you'd mentioned in your email that, and I got a little bit confused. That's why I'm asking. So are you guys hoping to be working in the same place at the same time, or are you going to be sort of like alternating days? Like what
eventually?
Kind of
so it'll mostly be altering days. So one of us can stay home with the kids, another one can be in the practice.
Okay. And
And
but the
then
goal.
5-year plan or so, 7-year plan
Okay.
once the kids are in school. When they're all physically in school and we're both
Yeah.
working, and then person comes in a little later, leaves a little early to get the kids, pick them up, kind of thing.
Yeah. So I mean, you're sort of planning on having the capacity to have two docs working in there at the same time, that being you and your wife at some point down the road.
Yep, and potentially more, so but at least that, yeah.
Okay.
More being like an associate?
An associate, partnership, depending on just kind of how relationships work or end up going.
You mentioned that depending on how some relationships go between you, your wife, and potentially another associate, you'd be amenable to a partnership or something like that. That's kind of a lot of moving parts, and I'm not entirely sure about what the vision is of the actual ownership structure. So I mean, between yourself and your wife, do you guys have like a very clear idea of where the leadership's going to be, how things are going to run, and in the long term when everything's kind of settled in, what that structure actually is, or is that something you're kind of still trying to flesh out?
So long-term wise, we're open to different options. I mean, short-term wise, like I would be working 3-4 days a week, and she'd be 1 or 2, where I'd be the primary one over things, but she'd obviously have input and things like that. And so, I mean, we want to run things kind of together, but ultimately, like I'll be the primary one in there, if that makes sense.
Okay. Yeah. So you're seeing yourself as the primary owner in the situation. I guess I was just kind of curious about where the partnership aspect of it came from and why there might be some interest in that avenue.
Yeah. I mean, just in the military, I've always worked with other people, and I've worked with a bunch of different people. And so the right person comes along and we want to keep them around, and they want to own, and we could look into that. So that's kind of the 5 to 10 year plan down the road. So if not, then we could potentially be fine just me and her, or doing an associate. So we're open options. But what we like about having someone else in there is some flexibility with
Okay.
my wife's from Ohio, and
Okay.
And so we like to have some flexibility getting home, spending time there with her family, and not being 100% tied to the practice.
Right. So in a sense, I guess with the partnership part, you were saying, if you really liked a particular person, you could maybe offer them some buy-in, and that could maybe give you and your wife some flexibility with regards to, having time off, or, if a contingency occurs, you guys can go, take care of the kids and stuff like that. Is that what I'm getting?
Yep.
Okay.
Yep.
Okay. So, knowing some of the priorities that you guys have in mind, how has that sort of helped shape what you're looking for in a practice?
So it's I mean, with what we're looking for in a practice, I mean, I feel like it starts kind of where we want to be, and then like number of chairs that we're looking for, and size of the practice. So we want something that is a little bit smaller to start, but something that we can grow into as well. So kind of the 6 to 8 chair range with potential for growth is kind of where we're looking for there.
Okay. So you have a couple practices in mind, right? So tell me, well, first of all, exactly. I mean, you already kind of mentioned what you were looking for in them. So tell me a couple of things that attract you to both of these practices, and then we'll kind of get into, how you came about them.
Okay. So for the first practice, it's more of a metro area. It's a very stable practice, consistently collecting a little over $1 million per year for the past several years to a decade. And so just very stable. It does have another half of the practice that is owned by another provider that is looking to potentially sell down the road in 5 years, give or take a couple years. And so that gives an opportunity for growth that we could potentially be interested in.
So they like share a building, or that's like the building over? What is that?
So they share a building.
Okay.
And so they share a space. There's not a a wall in between them. So it's just,
okay.
But there are like separate reception areas. So you go one
Really?
way to one side of the practice, one way for the other side of the practice, but in the back it all opens up. So they do
Okay.
have an agreement where like they help cover for each other when the other person's gone, if any emergency patients come in like that or
Okay.
anything. So
Okay. And
How old is the owner of that
yeah.
practice?
the other practice, around 60.
Okay. So have you been in conversations with them at all about, what their sort of timeline is and whether or not they'd be willing to sell at some point?
Indirectly, yeah. So they've given the through the owner and a friend of mine that knows the guy, around like 5 years, give or take, is kind of the timeline there.
Okay. So kind of a soft timeline there.
Mhm.
Yeah. Yeah, you look like you have something to say there, George.
Yeah, I do. So this is I have thoughts on these because at first, I think they could be looked at two different ways, right? One way you're looking at it, you're thinking, wow, this could potentially be really messy because I'm like right next to another dental practice.
Mhm.
But Clay, one of our interns, he's in this mega practice, which pretty much resulted from one guy doing this 3 times. He bought a practice and there was like these 3 docs and they all shared this giant waiting room. And then he just bought out each practice and now he's left with this like monstrosity of a beautiful, wonderful practice
Right.
that I'm in love with. And, and so I see this as a potentially great situation where if you could potentially expedite the timeline as well with a reverse associateship and you could buy that thing sooner potentially. So there's a lot of opportunity here, but it all is dictated on you buying that other practice, right? You don't buy that other practice, then it just is a problem.
It's a little bit of a wild card from everything that we, as much as you can know about it. We feel good about it. The guy seems really nice. Both the seller and that individual have really good reputations in the community. So, but yeah, it does depend on things working out. But as far as like where things are now, it's as favorable as you could hope for.
Right.
Okay.
Right. And you did kind of mention at one point that I mean, I don't know how all, types of military clinical settings are, but you said that you're used to working around a lot of people and perhaps be amenable to making a much larger practice with, other associates other than yourself and your wife and perhaps, creating that sort of mega clinic that is George's wet dream.
Yeah. And
that term where that's not going to be repeated again. That is a off limits term on the show. That is not how we're going to describe my desire for a good practice.
It's my show. Say what I want.
Hey, you don't got to be ashamed of your dream. All right.
You should be.
I'm not. I'm just calling it a wet dream. I'm not okay with that.
Fair enough.
Yeah. It was really all about saying that about George. I apologize, but yeah. So I mean that's just one kind of wrinkle in it, right? I mean that's sort of like bird in the hand versus 2 in the bush, right? Like I mean that looks like it could potentially be an opportunity down the road, but you can only be so sure, at this point, especially with how things are kind of moving currently. Okay, so is that everything we kind of want to hear about Practice A up front, George? Do you have any other questions?
Yeah, I kind of want to give a rundown of Practice A. So first of all, how did you find Practice A?
So Practice A was through a broker. So it's on market and it's one of those that's kind of going quicker.
Okay.
So,
and let's go through a rundown of, let's give the snapshots. Our listeners have no idea what this looks like. They have no idea what it collects, what it costs, all that stuff. So let's kind of give a, I guess a surface rundown of that practice.
Yeah, so collections are a little over $1 million a year. The asking price of the practice is about $900,000.
Okay.
And so hygiene program is really strong, about 35% of the practice. And so they've got 10 hygiene days on 4 days a week.
Okay.
And so, really strong hygiene program where it's got 3 hygiene working 2 days a week and 2 hygiene working 2 days a week.
Okay. And then, So I just, for our listeners, I quickly calculated it. We have the more accurate numbers here. It's about 78% of collections is the asking price.
Yes.
So that, because when you said like doing over 1,900,000, it could have been construed as like 90%. It's like 78. So
Yeah.
pretty reasonable. And then staff costs are in line. And no, I mean, there's no costs that are out of line.
Yeah.
I'll put it that way.
Yeah.
It has a little bit higher overhead than what we'll see with Practice B, but everything is kind of on the upper end of normal. I think that's kind of how I would describe the overhead across the board. Upper end of normal.
And I think it being you mentioned it was in a metro area. I think perhaps that would be, kind of more of the norm in that sort of demographic, I would think.
Yeah, I do have a friend in the area, and he said the same thing.
Yeah.
So what is the doctor makeup? Is it just one doctor?
It is.
So one doctor working out of 6 chairs with 3.5 or 2.5 hygienists.
Yes.
So this guy is pretty quick.
Yeah. So he's I've looked at the schedule, and I thought maybe he'd, be running 2 hygiene with like the third hygiene doing like perio maintenance or something like that, where he's only doing 2 hygiene checks. But sometimes he'll be doing 3 an hour.
And is this guy willing to stay on?
No, he's out.
Okay. And what about the other guy? Do you know how many hygienists he has?
So he has 2 full-time hygienists. I think there's some there's 2 hygienists at a time, I should say. So some work part-time, but 10 hygiene days over 5 days a week.
I really wish we could just have a video clip of George's face lighting up when he hears that. I really do.
Yeah, man, that's a total of 5 to 6 hygienists in those 2 offices. Oh man.
Oh boy.
Okay, let's go on to Practice B.
I will say that Patrick, we did kind of have an idea of how some things would go here, but
and it is not going that way.
I can see the train derailing now.
Yeah, no, we were both, and I even told the email Practice B looks better, and but I'm loving this situation in A here. I can't not love it. So let's talk about Practice B, and then it's a decision, right? Personal choice. Yeah. But let's unpack Practice B. And how did you find Practice B?
So Practice B was an off market through my friend in the area. So they share an accountant, and through the accountant, they let me know that they were looking at selling this summer.
Okay, very well. So that's how you came across it. So have you had any conversations with the seller? How comfortable they are leaving? Are they looking to stay on? What's their transition look like?
So yeah, this one's completely different. So he wants to stay on. So I would call this kind of the more rural option.
How far away from a metro area?
20 to 30 minutes.
Okay.
So not bad.
Yeah. Okay.
Okay.
But it's in a small town of less than 10,000.
Oh, okay.
Just 2 dentists in the area. It started out as a pediatric practice that ended up evolving into almost exclusively a general practice office. So the current owner is a pediatric dentist. He works 1 day a week doing pedo, and then the rest of it is associates working the rest of the week.
Okay.
So, no specialists in the area. Everybody gets referred into.
Does he own another practice?
He does.
Where?
In town.
So 20 to. So this is like his rural satellite practice.
Yep.
Okay.
So, but he's had it for decades.
Okay.
So, but he's actually not practicing in the other. He owns, but he's not really practicing. He's gearing down.
This is the most impressive seller I think I've ever heard of.
This is 1 day in the satellite.
This guy's just absentee owner of these 2 offices. Like, what the heck? Yeah. I don't think I've ever heard of a seller like this. How old is the guy?
So he's in his 70s.
Wow.
Okay.
Yeah.
Good for him.
That's fantastic.
This is
Yeah.
so we normally write the stereotype of a seller is like guy doesn't even know where his profit and loss statement is located, and like he, just whatever, just kind of goes to work, takes home some money, doesn't know how much, and this guy is just the total opposite. Good for him.
We might need to have him on the show.
Yeah, right.
He is
This
a
is an
really nice
enigma.
guy.
This is an enigma of a seller. This is
really
cool.
is.
All right.
Yep.
Yeah.
Okay.
And this practice sort of being 20, 30 minutes outside of town, does that make any difference for you and your wife in terms of where you would be living? Is there any compromises there?
Potentially, we haven't 100% figured that out.
Okay.
The schools that we'd likely be interested in going to are in town. So we'd we'd lean toward living in town and commuting the 20, 30 minutes, which would be fine.
What schools are you guys going to? I'm just kidding. You said it as if you guys are going to school instead of your kids.
Yeah. It's a really nice elementary school I was wanting to go back to.
Yeah, I got to go back as a dentist to learn
Back to
about.
basics, man. Fundamental.
Billy
All right,
Madison.
so let's do the rundown of this practice.
Yeah.
Okay.
And
so
we have the exact same revenue.
Almost identical. Yeah. So a little over $1.1 million in collections. The selling price is a little bit less. So just over 800,000.
So that's 73% instead of 78% for our listeners who are following.
So you get a little rural discount.
Sure.
So, but yeah, we would there would be some adjustments in the practice that would need to take place. So the owner wants to stay on initially and then taper off. So my hope would be to maintain the pediatric day that he works. With the bet that, or the hope that the people would want to or prefer to stay in the area instead of go 30 minutes into town for the pediatric dentist. So
what is what is he staying for other than that? I mean, he's hardly even there in the first place. Like staying,
I think he likes it. He likes the people. He's really tied into the community there.
Sure.
So make sure they're taken care of.
Yeah. So that's a piece of your goodwill there in a way, probably. I'm feeling he's a popular guy. Yeah. Not working because he has to. Sure.
Absolutely.
Okay. Yeah. So, I mean, you did mention that you had some pediatrics in your background as well. So, I mean, eventually you probably be comfortable taking over and maintaining that yourself too. I mean, that kind of speaks to.
I would. That would be my hope. So,
okay.
I enjoy pedo quite a bit. I wasn't sure. I like kids a fair amount in general. I wasn't sure how it would working with them, but in private practice working with them, it's worked out great. So they've actually got a really good system where hygiene is anesthetizing, and they've got the assistants doing the coronal polishing, and so a really good system going there that it's really attractive to me.
Yeah. So before we get into the weeds, I mean, in your heart of hearts, our opinions that we already kind of mentioned and have already kind of been thrown out the window aside, are you leaning a certain way? Do you kind of feel, sort of more towards practice A or B?
So,
and why?
So I'm torn. I mean, I guess heart of hearts, like I really like practice B. I like the small town. I like that there's no other specialists in the area. So he's a pediatric dentist that the practice has grown with them. And so a lot of those pediatric patients are kind of more in the age of getting wisdom teeth taken out. And so like I like that there would be a lot of extractions to do. There'd be a lot of pedo to do. And so I think this things would line up initially potentially very well with that practice. And then in the long term, just with no other specialists being there.
Yeah. So one, not necessarily predicament, but one thing that I'm kind of thinking about, and it's similar to situations we've seen in the past, is that when, you're sort of looking at eventually having this group practice, and the practices you're looking at the current production level they're at are they look more like really high producing solo offices that have potential to grow into group practices.
Yeah.
And so then the next question becomes, okay, well, if those two things are equal, then where's the growth potential between the two of them? And it seems like with practice B, which is something you seem to kind of be leaning towards already, you already have an advantage in that you have a clinical repertoire that's going to be an immediate value added as soon as you walk in the door, because you have all your prior training. So that's just one thing that kind of strikes me as far as the growth potential is concerned.
Did we talk about how many hygienists are in B? How many hygiene days?
That's important.
10 over 5 days.
Okay, so it's about the same as
thing.
the other practice.
Yeah, same deal.
And what about the associates? What's the deal going on with the other doctors?
So the associates in practice B. So there's a couple associates that both work part-time in that practice.
So is it one per day, or are they ever there on the same day, or how does that typically go?
No, they take turns, from what I understand.
And if let's just say you buy practice B, how would you handle that associate situation?
So we'd have to look more into it, if it'd be something that like where they could stay and I could do more of the specialty work, or if the numbers weren't quite there, then we may end up need to let them go. And then my wife and I take what they're doing and then try to grow the practice from there.
Okay. So I think let's look at A versus B, and let's kind of look at the two different options, and let's see which one maybe is a better fit for you, and then we could talk about our action plan as to how we are going to handle that.
Okay.
So I kind of agree, though. I like you are a complex procedure guy, and small town dentistry typically allows for more of that work. And, you get pulls. So, you're in a town of 10K, but it's probably pulling from an area larger than that, where you might have emergencies and things like that people are driving to see you to do. And so when it comes to a clinical repertoire standpoint, I like what small town dentistry type practice B offers that practice A doesn't necessarily as much offer.
Right.
And then typically, your carries risk is probably going to be higher in practice B than it is A. Potentially, I mean, I don't know. I'm just rural versus metro practices typically is what you'll see. So I don't know. I'm kind of curious to hear. It seems like practice A has a more complicated route.
Yeah.
And it's your personal preference if it's a simpler route in B that allows you to do the procedures you'd like.
Yeah, it depends on the problems you wish to have going into this.
Absolutely, yeah. So because another wrinkle is the owner or the seller is very motivated for practice A. So he's easy to get in touch with. Everything's quick. He's pushing to sell. He understands that with what's going on with the coronavirus, that the timeline may get pushed somewhat, but he's doing what he can to move the sell along. Whereas practice B has been more difficult to get a hold of, and I feel like it is a little bit less for sure thing, just because he has been more difficult to get a hold of. He's kind of been pushing the brakes more, and so just as far as like, do I think that practice B would happen? It's just going to be slower and be more patient, versus practice A is just like the guy he wants to leave. He definitely is selling. He may extend a little bit if required, but he's definitely out as soon as he can be. So,
right. I think you said that practice B was an off-market thing you found through a friend. So are you saying that you're not even really entirely sure that the seller is ready to pull the trigger? Is that what we're...
He is. It seems like it's just everything's like very like slow. Like it'll go like a lot of time will pass. I'll hear from him, and then so I've gotten a hold more of like his coach or the accountant more than him directly. So, but still, every time I talk to him, like super nice guy, like, and just it is more of a process where he's just wanting to make sure that the timing is right on things, and that his practice, his staff and patients are taken care of, and so the transition happens at the right time, I guess. But everything's just been much slower.
That's very typical of an off-market deal. So if for our audience, you found one practice through a broker, and normally when somebody has the urgency to reach out to a broker, they're ready to get this
They're ready
moving.
to go.
Like, they're not gonna screw around. That this thing needs to get sold. They want to get out, and typically like I'm thinking about selling my practice is a lot of how off-market deals are found, and so you have a little bit more patience on the side of the seller, and that comes through in the lack of communication, the difficulty gathering documents, and everything that you need, and that is honestly, I would try to make the decision ignoring that. And if you have to, you put your foot down and you say like, okay, this needs to happen by this date. We need to make some progress, or else I'm going to go take A.
Take it or leave it.
But I think I want you to be able to look at it a little bit more clearly and say, okay, assuming both of them close in a timeline that's amendable to me, agreeable to my plans, which one do I prefer? And kind of decide that way, and then go for your number one option.
Yeah.
And if it doesn't work out, then you kind of have your backup plan, and you draw a line in the sand. So I need this done this way.
Yeah.
Ultimately to not lose A, but you really want to make that decision of A versus B, not on a few months timeline of which one is going to close when, as opposed to what's the best one for me to own for the next 20 plus years.
Yeah. So, and it's just a little complex, right? So say I hold out for B and then A gets sold and then B's taken too long, doesn't end up working out. And then I end up basically back at square one.
Right.
Is the concern on there, I guess.
Would you rather own A, wondering, and this is your own choice.
Mm-hmm.
Would you rather own A, wondering what could have happened with B, if that's the one you want? It kind of sounds like that's the one you want. I mean, am I misreading you?
So it depends on if you're going with like heart or mind, right? So I mean, and it, I think I could make either one work. I think like immediately I can kind of create the practice more of what I'm looking for with B. I think with our 5 to 7 year plan with A, that we could turn it into that. But right now, that the practice A is kind of an older population. It's grown with the provider that's there, and so through marketing and things like that, we could get a younger population in there and change things up. But then we are, all the specialists are kind of right down the street and things like that, and so, it'd be more of a slow burn with trying to get that to where I want it, as opposed to walking in and kind of having it from the get-go.
Can I take a step back for a second?
Mm-hmm.
What is the new patient flow of each of these practices?
They're identical. So 12 patients a month.
12?
Mm-hmm. So I think.
What about the visibility of both?
So practice A, the metro practice is much better than practice B. So the practice A just hasn't been advertising at all, like with the hygiene that they have coming in, and he's been plenty busy, and so he hasn't been. He said at one point like he shut down like bringing new patients in, and then practice B, when the more rural location, it's kind of off a main road, so you kind of gotta go on the main road, take a turn, and take another turn, and then you get there. So it's in a
What about the other dentist in that rural area?
It's in town. It's better as it's in it's a corner lot between two main streets.
Okay, so talk about the heart versus mind thing. I want to see the flip flop. So explain both heart and mind, where they're at.
Okay. So yeah, I mean the rural practice is kind of when I'm talking to the seller and I'm looking at things, I'm a little bit more excited about it. The practice A is very straightforward. It's there for the taking, and it's got the option for growth 5 years down the road. It's been a very stable practice, so there's less variables to it as far as getting into the practice, and then it's just kind of working on increasing the patient flow and changing things up marketing wise and whatnot. There's a couple other things. The guy's just really involved in the community. I like the community service stuff that he's doing. I can see myself doing that.
Cool.
So I just feel like there's a similar like philosophy in life kind of a thing with him. And then, but the practice A just really is straightforward. The guy wants to sell. The practice is set up. I like the inside of the practice. It's set up really well to be highly productive. One other thing about the practice B, the rural practice, is just that being a pediatric, initially set up as a pediatric clinic, there's some of the chairs are in an open bay concept. And so looking at potentially having to alter that is a wild card.
Okay.
Okay.
Yeah. I mean, well, it seems like there'd be two very different routes to grow.
Yeah. Very
between A and
different.
B. And I think that, you know, the ease of transition and like, you know, the bird in the hand, two in the bush type thing, like this seller's ready to go, this seller maybe not so much. Like we put that aside, what you're going to experience in growing these practices is so very different. And it really comes back to what you're more comfortable with trying to grow, because you have on one hand, you know, the metro area practice and practice A that's seeing 12 patients a month, but not really doing a whole lot of marketing. So, you know, perhaps you could grow it that way and be a little bit more aggressive with that. And you're trying to alter the demographics of the patient population is currently in there. You're going to be battling a few different things. Whereas with practice B, it's like, in a rural practice, if you're going to be the guy all of a sudden that's local and can do all these special procedures, I mean, I think probably more than likely word of mouth is going to drive a lot of traffic your way, even totally aside from marketing. Just the fact that you are able to complete procedures that people have been commuting, 30 minutes for before. I think it's more automatic based on just the experience that you have. So it kind of depends on, what kind of problems you're willing to work with. I mean, when you look at George, who grew a $1.2 million practice, that's where it started at. Correct, George?
A little less than 1.1. Yeah. So it was about the size of these practices. Yeah.
Okay. Right. So similar practice, but he grew it in a way that has been hard at times, but he's very much enjoyed because, frankly, this is what he does. Like he likes to grow the sort of practice that he had through the sort of ways that he did it. Can you explain a little bit about that, George, and maybe illustrate to Patrick some of the challenges that you encountered?
Yeah. So I'm actually going to, Patrick, do you mind if I just paint two pictures for you?
Okay. Yeah.
We're looking at two completely different photos here, right? Mm-hmm. We have practice A, which, right, let's begin with the end in mind. At the end, let's say you got a practice doing 2.5 million with 12 ops. You have about $1.5 million in debt because you had to buy two practices to own it. And this is a location able to get the high new patient flow. I mean, you have two dentists right next to each other. So they've been sharing new patients for years, and they both have over two hygienists. This is an area where patient flow is possible. It's an area where you can have a large, robust, this is a great, large, robust group practice, 12 ops, plenty of space, metro area, great patient flow, multiple hygienists, multiple dentists. You might have two associates, you and your wife are taking turns owning a large, very large practice, a lot of stress. Your stress is going to come from, your marketing, your merging of the two practices, merging of the two waiting rooms, the two teams, a lot of management stress.
You'd be having a hell of a time right now.
And you will end up doing some advanced clinical procedures. You're probably not going to be a huge fixture in the community compared to the rural practice.
Yeah.
That I would paint that as A.
Mm-hmm.
B, it's you or your wife and one part-time associate or whatever. There's never going to be that like monstrosity of a practice. It's always going to be kind of maybe a little bit larger than it is now. Let's call it maybe 1.8 million is about where you'll end up. And you and your wife, you work, you're in the community, you're doing more complex procedures. It's a lot simpler of a path with a lower ceiling due to the new patient flow issues that you might have. But your procedure mix is going to be a lot more enjoyable is my guess. And your relationships with patients is going to be a lot more enjoyable.
Yeah.
And so I paint those pictures to you to ask you which one appeals to you more. I am very strongly linked towards A. right? I think that is but again, it's like, who is the buyer making the decision, not what practice is better. These are two, like, let's commend you for a second. You're sitting here on our show with two great options, both arguably better than the one I bought, right? So I bought a practice. It was doing 8 ops, a little less than 1.1, and I had to grow it, right? I wanted to grow the monstrosity. And so I had a patient flow problem because the number of patients in my practice was not, you get to get the monstrosity by just buying 2 practices right next to each other in the same space. Like, that's a very straightforward way to get the monstrosity. I have to grow that. And it's been challenging to be patient enough and to get that type of patient flow to get that practice. And so a lot of your work in both opportunities is internal. And so I think that's very fortunate, where you're not super dependent on, the external marketing or whatever to get your kind of end game on both practices. But nonetheless, which of those 2 pictures fits Patrick and what Patrick wants and who Patrick is better, I think is ultimately the decision you make.
So you're a pretty good picture painter.
He's a Bob Ross.
Yeah.
of the dental landscape.
It's good stuff.
Visionary.
Right. More debt, more stress, more management, higher maybe I'd say you make about the same both, to be honest, because I think you probably work a little bit less in practice A, but I think you make about the same in both because your overhead in practice B is less. So to be honest, I think income you're looking at about the same in both.
Yeah. Should we flip a coin?
No. Definitely do not flip a coin.
You're not a coin, Patrick.
Why did you go this? Why do you have all these problems? Right? It's do you golf, Patrick?
I attempt to golf.
I'm a big golfer, and I love to use this analogy in pre-owner coaching. It's golf is a game of misses. It's not about your best shot. It's about how bad is your worst shot, or how bad are the mishits, and missing in the right spots is really how you play golf. I think when you get good, that's what they say. And for you, it's what problems do you want? Every practice you buy is going to have problems, issues, stresses. And which ones do you want? Do you want the stresses of practice B, or do you want the stresses of practice A? They're very different. And so I wouldn't look at the upside as much as at its ceiling and at its, mature practice, which problems do you prefer?
Yeah. So both of them sound good. I mean, honestly, the practice B is kind of more up my alley. Just on with the picture that you're painting.
I totally agree.
I do like being a part of the community. I like doing I've never been like do a million exams and then try to like balance a whole bunch of different things. I can kind of focus more on what I'm doing. And
I mean, there's a reason there's a reason that guy's still chumming along at 70 years old.
Yeah, yeah, exactly.
Yeah. And there's a reason the other guy is like wanting to sell like yesterday.
It's a good point.
Right.
It's a good point.
He's got 2.5 hygienists annoying him every hour.
Yeah. Do you guys want a third wrinkle?
No.
Okay.
But you're gonna have to.
But you got to tell us anyway.
So my friend is kind of like the guy that I would work something out with my friend that's in that area.
The other dentist in town is your friend, or is he somebody who would like to work in town? Is this male friend practicing in the area?
He is.
Or so is he the other dentist?
The main road? Nope. He's in so if there was a triangle in the town, he's like in the north side of things. So
I thought you said there's 2 dentists in the town.
So yeah, I mean, so there's 2 dentists in the rural town that as opposed so the dentist.
So he lives in the metro town that's further away.
Yeah, north of the metro town in a different area.
Okay.
Oh, okay.
And so you like the idea of working with your good friend in your practice potentially, and then making that a partnership in the future.
Yeah. So the idea with him is that was my initial option in the area that got us interested in the area. And then because things weren't really working out there, basically he so he's got a couple associates right now, and he's looking for another associate with the potential to turn those into partnerships, but he hasn't done it, and it's like 2-3 years down the road. There's not a clear path to ownership. He likes working Saturdays.
Can I throw something at you?
Yes.
Practicing with your wife or your friend, pick one. Don't do both.
Okay. Yeah, I picked my friend. But that being said, my wife and my friend, they get along.
I know, but like, how many cooks in this kitchen are we asking for, man? Like, you got you, your wife, your friend, like owning this practice. That sounds like such a get like the reality TV cameras in there, man. Like,
sounds like Three's Company.
Yeah, seriously. So I'm not saying it can't work. I'm definitely not saying that. But like everything that we've made the decision about B for has been simplicity.
Yeah.
I love the simplicity of B. B is really simple. And this is like, hey, let's just F up all the simplicity and just like have my best friend own part of this practice too, or whatever, you know?
And ultimately that's why it hasn't worked out.
Yeah.
Yeah. And I think that's smart though.
Keep him as your friend.
Yeah.
And and introduce him to the guy who has practice A after you close on practice B. And then boom, he'll love you.
There you go. Yeah. I don't believe the next level in friendship is a partnership. That's the beginning of the end.
You're talking to a guy with 2 partners on shared practices here, but you know, in general, right? We became friends through partnership, not friends first, then partnership. But anyway,
okay,
yeah, I would just say just a big X on that. Like the second you brought it up in the beginning, Tyler and I were both like looking at each other like, is this guy really want to partner with someone else and his wife in the same practice? Like that just that doesn't sound like, and right. We can always do the, you know, I call it the glorified associate partnership model where you throw them 20% equity or whatever and some discount to keep them. Like that's not a partner. That's a glorified associate with some equity.
Okay. Yeah.
You know, but like a full decision-making equal partner, like you don't need any more of those.
Yeah.
You know, like, trust me, like, right. You're talking to a divorced dentist who worked with his wife as a dentist in a practice. Like it's a toll. And, you know, I think adding another partner to that mix does not sound like something I'd ever want to do. Husband and wife practicing together, I'm good with, you know, I did it. It has its pros and cons, but
So wait, so you practice with your wife?
Correct. My wife, ex-wife now, is a dentist.
Okay.
And we work together. And that wasn't the reason we got divorced or anything. But it wasn't like it wasn't like couples therapy for us going to the practice every day together. Like it wasn't a romantic getaway that brings you closer together. That was not the experience of owning a practice together. So again, not the reason, but you know, if I'd be lying if I said it wasn't a contributing factor.
Okay.
So, you know, but again, I'm not saying, right. I have a coaching clients that are married. Like it is what it is. It's totally doable. Like that is not why
we've really enjoyed working together.
Yeah,
I mean, it was dental
saying
school.
That's going to happen to you.
Yeah, no. So I understand.
Yeah. So I think looking at this now, I want to address the one thing that I want to address before we wrap this up is the associate in place or the associates in place and how to handle those. I mean, we're deciding on B. For all intents and purposes, for our audience, you know, we're going forward with B. So how are we going to handle those associates? I feel like that's the last piece that I want to bring together before we really wrap up. So what are your thoughts on that situation?
So ideally, I like having someone else there. Again, having that flexibility of, you know, we're going out of town to visit family, or we just want to travel for whatever reason. We've got someone else there in the practice, so there's always someone there. If we can swing it from a financial standpoint, we'd like to. But if the numbers aren't there to support that, then that's where we wouldn't be able to do that. So,
can I offer my unsolicited advice?
Please.
So, yes, that is in my mind, right? Based on your vision and goals, that is 100% the right play. You keep the associate. And I think the one thing that Tyler and I looked at this practice B is there's a lot of dentistry to be done that's not getting done.
Mhm.
So you're going to walk into hygiene, and you're especially with the procedures you're adding and your skill sets, you guys are going to be really busy on the doctor side. And so I think a combination of just doing more dentistry because you're referring less, doing more potentially on the same number of patients, you're going to be busier clinically, and then potentially adding some hygiene, adding a third hygienist and trying to keep them busy.
Mhm.
Between those two things easily can swing 2 doctors there. And now you've kind of immediately put yourself into that position of comfort where you have the correct number of doctors, and then you just grow slowly. And initially you might take an income hit doing it that route. I think you've acknowledged that, but your overhead is low in the second practice. Your rent is a lot less, your fixed costs are less, your staff costs are less. Well, staff costs a little more, but
they're about equal.
About underproducing a little bit too in my mind. So
yeah,
a lot of benefits to practice B financially speaking, where I see you walking in and being able to keep that associate and stay busy enough yourself. So I think it's a very wise move to keep that associate, because it's also hard to staff associates in rural practices sometimes.
Absolutely.
And they've been going there and they've been staying there, and having multiple doctors is a big benefit in my mind because patients get less picky. You working part-time so you guys can cover for each other. And so in general, I would not touch that. I would add myself to the practice. You and your wife, I consider you guys one doctor. You guys are alternating days, and I would not get rid of an associate. Maybe your wife replaces one of the part-time associates you don't like potentially, and you bring the other one on a little bit more or something like that. But I would keep another doctor there as much as possible.
Yeah.
Okay. Yeah, that sounds really good.
I think we're looking at this practice. It's doing 1.1. And this is the type of practice you walk in overnight. It's like 1.3, 1.4 just from a different provider. So that's really how I'm looking at practice B. And again, like if I was you making the decision, I don't think that anybody is listening to this and not thinking I would pick practice A. I would 100% pick practice A. But that's because the second practice changes everything for me. If we take out the second practice, practice B is a much better practice across the board in every way.
Yeah.
So, I think practice B is for you a great choice, and keeping that associate is a really fantastic move, and growing that way. And then you kind of just leave out everything to talk about with your friend. Just like, don't do any of that stuff. And I think you're like really golden.
All right. I'll
long lost lover from high school. Okay, man.
Yeah. That sounds good. We'll keep it focused.
What do you think, man? Patrick, how did you enjoy this?
I liked it pretty well. So I appreciate your guys' perspective. It really helps clarify some things that I kind of had in my head, but just with things kind of getting tugged in so many different directions, it's hard to all straighten it all out. But being able to bounce it off you guys, and that Bob Ross painting was really good.
It really ties it all together, doesn't
it? It does. So, really helpful.
Yeah. Cool. Well, we really appreciate you bringing it to us, Patrick. That means a lot to us that you would, consult us, and we're really happy to help. And I want to see where this goes. I want to, see how the process moves along. I wish you guys the best, and I believe you're going to do great. And I want to hear all about it.
All right, appreciate it. Yeah, I'll be in touch. Let you guys know how it's going.
Please do.
Thanks, Patrick.
All right, thank you guys.